The best way to actually deliver your baby is in any position that will widen your pelvic plane. And again, laying on your back, you kind of close it a little bit. Like when you're laying on your back and you got your legs up, you actually close it. I mean, the idea of a baby getting stuck is part of just how we're doing it. It's not really because that's normal and natural and it just happens. I mean, because I know everything is just happens in our medical system. It doesn't really work that way. But if you're in a squatting position, it actually opens up your pelvic plane by 20 to 30%. And is a, you know, the way women probably was giving birth for eons, and now all of a sudden, you know, we have changed everything, and actually is just not what's best for us. Another thing we do in the hospital that's just, to me, like, just a whole, I mean, all of these are bad ideas, but this is a bad idea. The second a woman gives birth, give birth and delivers that baby, the first thing a lot of times doctors and hospitals do is whisk that baby away from the mother. Go weigh it, clean it, wash it, and do all these things. That sounds normal because it happens all the time. So it sounds really normal to most of us. Sounds perfectly normal because that's what we've heard. And that's what happens almost all the time. The problem is this. The most crucial time for a newborn baby is about an hour after it's born. Partly because, you gotta think about it, it just left the safest environment in the world. It just left listening to your heartbeat 24/7 since the day it was conceived 9-10 months ago. And the first thing you do is take it away from the warmth of the mother, the warmth of her body, and go put it in some water where it can have dangerously decrease the baby's temperature. Because a very important concern after a baby is born is its temperature. Is making sure the baby's temperature doesn't drop. And the safest, best thing you can do is lay that baby on the mother's chest. So again, it can keep hearing the mother's heartbeat and relate to the warmth of the mother's body. And so we're not doing that. And what that does is multiple things. It decreases nipple stimulation for the mother, because if we're not letting mothers immediately breastfeed or connect and be close to their babies, their nipples and their body is gonna not do all the things that it should otherwise do. So nipple stimulation is important for multiple reasons. It helps with uterine, helps your uterus contracts. And after birth, that's very important because when your uterus contracts, it makes sure, it helps prevent postpartum hemorrhaging. And so when you hear about women, bleeding all over the place, the hospitals increase the risk that would happen, partly because they are not letting women suckle immediately. They're taking their babies away. And so your uterus may not contract. And doctors always got a solution because they want to give you their medications. One thing they'll do is give women synthetic oxytocin or something to help their uterus contract. And of course, nature's just better. It's just a lot better. I mean, because we know, and I'll talk about drugs in a second, we know that, drugs have many side effects. And so it's better if you let the body does it. Another thing it does is it reduces milk supply. Is that if you don't allow me to immediately start to suckle and prepare my body that, yes, I'm going to breastfeed. Because milk is literally it's supply demand supply. If somebody wants milk, your body will produce it. And so if you're immediately taking the baby away from the mother, and sometimes for hours or for quite some time to check it for different things and give it shots and all this stuff, when that baby, that's why babies are screaming and crying for so long. Because they are just like, what happened? I was in the most wonderful place, in the most wonderful land ever. And now all of a sudden we take a baby and separate it completely from its mother. And we just shouldn't be doing that. I mean, it's not good for the mother. Neither is it good for the child. I read a story the other day. I posted it on my Facebook page that just talked about how a mother brought her own child back to life by immediately. I mean, the baby had passed away. And she held her baby and talked to her dead baby for 2 hours. And after a while, the baby came back to life. And it just shows just how important that, hearing the mother's heartbeat and the temperature coming from the mother transmitting to that baby reminds the baby of the womb. You don't want to immediately separate a baby from that. So that's not a good idea, but we're doing it all the time. It's the most normal practice in the world. To talk about drugs, the routine use of drugs that should only be used in extreme circumstances is dangerous, and it's not a good idea. But we do it all the time. I mean, you go to the hospital, if you're, they induce people all the time and give them Pitocin in order to make them artificially go into labor. Of course, the best case scenario of your own body tells you when to go into labor. But what we're doing is giving a lot of women Pitocin. A lot of women get Pitocin. And again, it's because you're not, unfortunately, it's because you're not progressing the way they say you should progress. Our bodies are unique. And again, if we treat it like an illness, that's why we keep telling women, oh, you haven't dilated as fast as we thought you should. That's not a health concern. But we treat it as if it is because we want to get one woman in, the next woman in, and keep the process going. We don't want to take the time to actually treat the woman as if her body's natural and normal and it may not go on the doctor's clock. So a lot of times, a lot of women will get Pitocin, or doctors say, oh, well, we just want to speed things up, so let me give you some Pitocin. This is not a good idea. Unless something drastic is happening, it is not a good idea. This drug has many side effects. One being women who were given Pitocin, and this is a study by Colorado State University not too long ago. They found that women who were given Pitocin during their birth doubled the chance that their child would have ADHD. And I'm just thinking that's crazy. So why are we so quick to give women these drugs that their bodies don't want? And Pitocin is the artificial oxycontin that our body creates when we're giving birth. And so when we do it synthetically, we unnaturally contract the uterus. And when you unnaturally do it, you increase the risk that you'll end up with a C-section because your baby has an increased risk of going into fetal distress. And that's a very common reason for C-section. We always say, oh, the baby's in distress. Well, had you not given me these drugs and told me you need to speed me up on your clock, I wouldn't need it. So those are the types of things we just shouldn't be doing. And another thing is epidural. Unfortunately, like I said, given that we birth in such a way that makes birth even more painful, stressful, and just uncomfortable, a lot of women immediately go for the epidural before they even give birth a chance or even try to prepare it at all. And the other thing is, when you go to the hospital, they're going to offer it to you. They're going to offer it to you a million times. Oh, you sure you don't want me to give you nothing to make you more comfortable? And we shouldn't be doing that for a couple reasons. I mean, again, epidural drastically increased the risk of a C-section. And it tends to slow down your labor, which they tend to fix by increasing the amount of drugs, Pitocin, that they put in your system. And the thing that's scariest to me about epidural is that we don't have any good research I've seen as of yet about how epidurals affect babies. We know they make them a little bit more drowsy. It may make it harder for them to latch on to the nipple. And it's like, why are we even risking breastfeeding when we know that that's one of the best things nature gave to babies? But we're doing it just routinely, and nobody's really raising a red flag. And that's, I mean, it stands to reason if we have the highest infant mortality rate among developed countries and a significantly higher mortality rate than 40 other countries. It says a lot about, well, we are doing something really wrong. And so a lot of these things that I talked about, like I said, not being able to eat, being confined to a bed as if something's wrong with you, pushing in a reclining position, separating the mother and the baby immediately after birth, and using epidurals and Pitocin like it's just the easiest, most wonderful thing ever. There's so much more I can talk about on this topic, but I just kind of want to give an introduction to birth in America, and I hope you've learned quite a bit. Thanks for tuning in. I'll see you again later. Bye.